Pain affects every aspect of my daily life, from the time that I wake up to the time I go to bed. This was a statement made by one of my patients to me many years ago. No patient should ever have to feel like this is their daily life until they die. The Oncology Nurses Society describes that 20 to 75% of patients will have pain at diagnosis. The National Comprehensive Cancer Network, or NCCN, describes pain as an unpleasant sensory or emotional experience associated with actual or potential tissue damage. Pain can be acute, chronic, breakthrough, or refractory. As an oncology nurse of 29 years, I have worked to assess, treat, and evaluate thousands of patients during my nursing career. For the purpose of this speech, chronic cancer pain is described as being longer than 3 months in duration. Whether it's you, a family member, or friend, most likely at some point in your life, you're going to have some contact with chronic cancer pain. Today, we're going to be discussing the assessment, management, and evaluation of chronic cancer pain. For my first point, in the assessment, there's several things that can be done to assess it. Most of you, if you've ever had pain, you've been asked to describe it on a scale of 0 to 10, 0 being none, 10 being the worst. Some of our elderly patients or others may have difficulty with being able to rate that, and we use the Wong-Baker Pain Scale, which listed as smiley faces in varying degrees of pain, and that helps us give it a number. For people with dementia or cognitive problems, we have to use their physical being in order to discuss what the pain level is based on whether they're withdrawing, grimacing, moaning, or things like this. You can find this on the University of Florida's Pain Assessment and Management Initiative webpage. There are different types of cancer pain. There can be somatic, which is in the muscle or tissue or bone. Sometimes you get that with bone metastasis from cancer. Visceral pain is more in the liver, prostate areas and can be very challenging to treat. Neuropathic pain is very distressing to most people because it can be a painful, burning, numb sensation that is very difficult as well to manage. Setting a realistic pain goal is very important with your patient because if somebody comes in with a pain score of 10 or better, you're not going to get it to 0 in the first bit of time if you can even get it to 0 at all. So setting realistic goals is very key. We transition to management of pain where a lot of times we'll use oral medications or pain patches and things like that. We typically start out with Tylenol or Aleve, ibuprofen, which most of you know about, opioids like your morphines and your Demerols and Dilaudids and fentanyls and medications like that. Antidepressants, anticonvulsants, steroids, and even cannabis can be very helpful. With people with bone metastasis, bone modifying agents can be used as well to help alleviate pain. Radiation therapy can be used to target certain areas where there is pain to get the tumor to shrink and cause less discomfort and pain. Education in the form of individual and group therapy, mindfulness, biofeedback, cognitive behavioral therapy can also be a very valuable tool in managing pain. When all else fails, palliative care can also be very effective in being a specialist to help look outside the box and try to come up with other methods that can help people in dealing with their chronic pain. When we evaluate pain, the NCCN uses the 5 A's. Analgesia, is it working? Activities, can you go back to doing some of the things that you want to do? Adverse effects, are you having constipation? Are you having sedation and sleepiness? Are you demonstrating any aberrant behavior like taking street drugs or taking more than the prescribed medication because you're not getting relief? And what is the effect on you and how are you managing with that? We'll want to be reevaluating. Do we need to set a new pain goal? Have you reached your pain goal? Are you satisfied with the level of management of your pain? If not, we need to modify and reboot and re-strategize for that. In conclusion, it takes a multimodal approach to deal with chronic cancer pain in order to receive the optimal outcome. Untreated or undertreated can cause significant problems and complications with your physical and emotional well-being and financial well-being if you're not able to work. Many people need to work to be able to have their insurance, so the impact of chronic cancer pain can affect the entire family. Having those candid conversations about what's reasonable and what to expect can really help patients on their cancer pain journey. In conclusion, we've talked about the assessment, the management, and the evaluation of chronic cancer pain. And hopefully, if you experience this on your end later on in life, you'll feel a little bit more confident in being able to talk to the treatment team about getting adequate pain management. Thank you for taking time to watch my video.